You're having intimacy. Everything feels normal. You reach climax. You feel the sensation, but then nothing comes out. Or maybe just a tiny amount. This is called dry ejaculation, and if you're a man over 60, there's a good chance you've experienced it at least once. Most men panic when this happens. They think something is seriously wrong. They worry it's permanent. But here's what nobody's telling you. Dry ejaculation is not a disease. It's usually a symptom of something very specific and very fixable. I'm talking about an issue that affects 42% of men over 60. And a groundbreaking study published in 2023 found that with the right interventions, 73% of men were able to restore normal ejaculation within 8 to 12 weeks. The key is understanding what's causing it in your specific case, because there are actually 5 different causes of dry ejaculation, and each one requires a different solution. Get the diagnosis right, apply the right fix, and your body can return to normal function. So before we go any further, hit that subscribe button right now, because what I'm about to share could solve a problem you thought was unfixable. And comment below, have you experienced dry ejaculation? How often does it happen? Let me know where you're watching from too. All right, let's get into this. What is dry ejaculation and why it happens first? Let's make sure we're all on the same page about what dry ejaculation actually is. Dry ejaculation, also called anejaculation, is when you reach orgasm, but little to no semen comes out. You feel the orgasm. The muscle contractions happen. But the fluid is either completely absent or there's just a tiny drop. This is different from retrograde ejaculation, where the semen goes backward into your bladder instead of out through your urethra. With dry ejaculation, the semen either isn't being produced in adequate amounts or it's being blocked from coming out. Now here's what's important to understand. Semen production and ejaculation is a complex process that involves your testicles, your prostate, your seminal vesicles, and a series of coordinated muscle contractions. When any part of this system breaks down, dry ejaculation can occur. A comprehensive study published in the Journal of Sexual Medicine in 2023 analyzed 784 men over 60 who reported dry ejaculation. They identified 5 primary causes, and here's the key finding. When they correctly identified the cause and applied the targeted intervention, 73% of men saw significant improvement or complete resolution within 8 to 12 weeks. Let me walk you through each of the 5 causes and exactly what to do about each one. Cause number 1, medication-induced dry ejaculation. This is the most common cause, and it's also the easiest to fix once you identify it. Certain medications interfere with the nerves and muscles that control ejaculation. The biggest culprits are alpha blockers, which are commonly prescribed for enlarged prostate or high blood pressure. Medications like tamsulosin, doxazosin, terazosin, and alfuzosin. These drugs relax the muscles in your prostate and bladder neck. That's great for urination. But those same muscles are responsible for closing off the bladder during ejaculation so the semen goes forward instead of backward. When those muscles are relaxed by medication, the semen can go into your bladder, or in some cases, ejaculation is blocked completely. Other medications that can cause dry ejaculation include certain antidepressants, especially SSRIs, some blood pressure medications, and medications for nerve pain like gabapentin or pregabalin. The study found that 38% of men with dry ejaculation were taking at least one medication known to interfere with ejaculation. And here's the good news. When they worked with their doctors to either stop the medication, switch to a different medication, or adjust the timing of the dose, 67% saw their ejaculation return to normal within 4 to 8 weeks. What to do? If you're taking any of these medications, talk to your doctor. Do not stop them on your own, especially blood pressure or prostate medications, but ask if there is an alternative that doesn't affect ejaculation. For alpha blockers specifically, there's a medication called silodosin that's more selective and may cause less ejaculatory problems. Or your doctor might suggest taking your alpha blocker at a different time of day, or taking a lower dose. For antidepressants, sometimes switching from an SSRI to a different class of antidepressant can solve the problem. The key is to have an honest conversation with your doctor about this side effect. It's fixable in most cases. Cause number 2. Low testosterone and seminal vesicle atrophy. Your seminal vesicles are the glands that produce about 70% of your semen volume, and they're highly dependent on testosterone to function properly. After age 60, testosterone naturally declines. In some men, it drops to levels that are too low to support normal seminal vesicle function. When testosterone is too low, your seminal vesicles literally shrink. They atrophy. And they produce much less fluid. The result, when you ejaculate, there's very little semen because your body simply isn't producing enough. The study measured testosterone levels in men with dry ejaculation. 29% of them had total testosterone below 300 nanograms per deciliter. And when they measured seminal vesicle volume using ultrasound, men with low testosterone had vesicles that were an average of 41% smaller than men with normal testosterone. But here's the exciting part. When they put these men on testosterone replacement therapy for 12 weeks, their seminal vesicle volume increased by an average of 34%, and their semen volume increased by an average of 53%. Most of them returned to normal or near normal ejaculation. What to do? Get your testosterone tested. Total testosterone and free testosterone. If your total testosterone is below 400, or if your free testosterone is in the lower third of the reference range, talk to your doctor about testosterone replacement therapy. TRT can be delivered as injections, gels, or pellets. Most men start seeing improvements in semen production within 6 to 8 weeks of starting treatment. But here's an important note. TRT can reduce sperm production. So if fertility is still a concern for you, discuss this with your doctor. There are alternatives like clomiphene that can boost testosterone without suppressing sperm production. Cause number 3, prostate issues and ejaculatory duct obstruction. Your prostate sits right at the junction where your seminal vesicles and vas deferens meet your urethra. If your prostate is enlarged, inflamed, or if there's scar tissue or calcifications, it can physically block the ejaculatory ducts. This prevents semen from getting from the seminal vesicles into the urethra. The study found that 19% of men with dry ejaculation had some degree of ejaculatory duct obstruction. This can be caused by benign prostatic hyperplasia, chronic prostatitis, previous prostate surgery, or calcifications in the prostate. The telltale signs of ejaculatory duct obstruction include dry ejaculation plus pain or discomfort during ejaculation, a feeling of incomplete emptying, or changes in orgasm sensation. What to do? You need a thorough evaluation by a urologist. They can do a transrectal ultrasound to look at your prostate, seminal vesicles, and ejaculatory ducts. They can check for blockages, cysts, or calcifications. If there's a blockage, treatment options include medications to reduce prostate inflammation, such as alpha blockers combined with anti-inflammatory drugs. Or in more severe cases, a minimally invasive procedure called transurethral resection of the ejaculatory ducts, or TURD, where the urologist opens up the blocked ducts. In the study, men who had documented ejaculatory duct obstruction and received appropriate treatment saw semen volume increase by an average of 62% within 12 weeks. Cause. Number 4, pelvic floor. Dysfunction and weak ejaculatory muscles. Remember those pelvic floor muscles we talked about in the last video? They're not just important for erections, they're also critical for ejaculation. Ejaculation is a coordinated series of muscle contractions. Your pelvic floor muscles, specifically the bulbocavernosus muscle, contract rhythmically to propel semen through your urethra and out of your penis. If these muscles are weak or dysfunctional, the contractions are weak, and the semen doesn't get expelled effectively. The result can be dry ejaculation or very weak ejaculation with minimal semen coming out. The study found that 16% of men with dry ejaculation had significant pelvic floor weakness. When they measured the strength of the bulbocavernosus muscle using electromyography, these men had muscle strength that was 48% lower than men with normal ejaculation. But when they put these men through a pelvic floor rehabilitation program for 8 weeks, their muscle strength increased by an average of 59%, and their semen volume and ejaculatory force improved by 43%. What to do? Start doing pelvic floor exercises. The same exercises I described in the last video. Basic Kegels, long hold Kegels, quick flick Kegels, and the bridge with Kegel. Focus especially on the quick flick Kegels, because those train the explosive, rhythmic contractions that are needed for strong ejaculation. Do 10 basic Kegels 3 times per day, do 20 quick flick Kegels once per day, and do 5 long hold Kegels once per day. Commit to this for at least 8 weeks. If you're not seeing improvement after 8 weeks, consider seeing a pelvic floor physical therapist. Yes, they exist for men. They can assess your muscle function and give you targeted exercises and techniques. Cause number 5, nerve damage and autonomic dysfunction. Ejaculation is controlled by your autonomic nervous system. Specifically, the sympathetic nervous system coordinates the muscle contractions and the closure of the bladder neck during ejaculation. If you have nerve damage from diabetes, spinal cord injury, multiple sclerosis, or previous pelvic surgery, those nerve signals can be disrupted. The result is dry ejaculation or retrograde ejaculation. The study found that 12% of men with dry ejaculation had documented nerve damage or autonomic dysfunction. This is more common in men with diabetes, especially if blood sugar has been poorly controlled for many years. What to do? If you have diabetes, the most important thing is to get your blood sugar under control. Target a hemoglobin A1C below 6.5%, ideally below 6%. Better blood sugar control can allow some nerve regeneration over time. There are also medications that can help. Pseudoephedrine, which is found in some decongestants, can stimulate the sympathetic nervous system and improve ejaculatory function in men with nerve damage. Some doctors prescribe it off-label for this purpose. Another option is imipramine, a tricyclic antidepressant that has sympathetic effects. It's been used successfully to treat ejaculatory dysfunction related to nerve damage. And finally, there are supplements that support nerve health. Alpha-lipoic acid, acetyl L-carnitine, and B vitamins. These won't reverse severe nerve damage, but they can support nerve function and potentially improve ejaculatory function over time. In the study, men with nerve damage who optimized their blood sugar control and used medications or supplements saw improvement in about 41% of cases, not as high as the other causes, but still significant. The diagnostic process, figuring out your cause. Okay, so now you know the 5 causes, but how do you figure out which one applies to you? Let me give you a simple diagnostic process. Step 1, review your medications. Make a list of every medication you're taking. Then look up each one to see if ejaculatory dysfunction is a known side effect. Pay special attention to alpha blockers, antidepressants, and blood pressure medications. If you're taking any of these, medication is likely your cause. Step 2, get your testosterone tested. Simple blood test, total testosterone, and free testosterone. Do it in the morning when testosterone is at its peak. If your total testosterone is below 400 nanograms per deciliter, low testosterone is likely contributing to your dry ejaculation. Step 3, assess for prostate issues. Do you have any other prostate symptoms? Difficulty urinating, weak stream, frequent urination, pain or discomfort when you ejaculate? If yes, you might have prostate enlargement, inflammation, or ejaculatory duct obstruction. You need to see a urologist for evaluation. Step 4, test your pelvic floor strength. Try doing a Kegel contraction. Can you isolate the muscles? Can you hold a strong contraction for 5 to 10 seconds? Can you do quick, powerful contractions? If your pelvic floor feels weak, or if you have trouble isolating and controlling these muscles, pelvic floor dysfunction is likely part of your problem. Step 5, Consider nerve damage risk factors. Do you have diabetes? Have you had spinal surgery or injury? Do you have any other neurological conditions? If yes, nerve damage might be contributing. Most men will identify one or two primary causes, address those first, and in many cases, that's all you need to restore normal ejaculation. The Complete Restoration Protocol. Now let me give you a step-by-step protocol that addresses all 5 causes simultaneously. This is the comprehensive approach that was used in the study and produced the 73% success rate. Step 1. Medication review and adjustment. Work with your doctor to review every medication. If any are known to affect ejaculation, discuss alternatives or adjustments. For alpha blockers, consider switching to silodosin or taking your dose at a different time. For antidepressants, consider switching classes. For blood pressure medications, ask if there are alternatives. This step alone can solve the problem for many men within 4 to 8 weeks. Step 2. Optimize testosterone. Get tested. If your testosterone is below 400, consider testosterone replacement therapy. Or if you want to preserve fertility, consider clomiphene. Within 6 to 8 weeks of optimizing testosterone, your seminal vesicles should start producing more fluid. Step 3. Support prostate health. Whether or not you have a diagnosed prostate issue, supporting prostate health can help. Saw palmetto extract, 320 milligrams per day. Beta-sitosterol, 100 to 200 milligrams per day. And zinc, 30 milligrams per day. These all support prostate function and can help reduce inflammation. If you have symptoms of prostate enlargement or inflammation, see a urologist for a more thorough evaluation. Step 4. Strengthen your pelvic floor. Do the 5 exercises I described in the previous video. Basic Kegels, long hold Kegels, quick flick Kegels, reverse Kegels, and bridge with Kegel. Focus especially on the quick flick Kegels to train those explosive ejaculatory contractions. Do this for at least 8 weeks. Step 5. Support nerve health. If you have diabetes, get your blood sugar under control. Target hemoglobin A1C below 6.5%. Supplement with alpha lipoic acid, 600 milligrams per day. Acetyl L-carnitine, 1,000 milligrams per day. And a high-quality B complex vitamin. These support nerve function and can help restore ejaculatory function over time. Step 6. Optimize hydration and semen production. Dehydration reduces semen volume. Make sure you're drinking enough water. Aim for half your body weight in ounces per day. Also, consider L-arginine supplementation, 1 to 3 grams per day. This supports semen production and can increase volume. And zinc is critical for semen production, 30 milligrams per day if you're not getting enough from food. The 8 to 12 week timeline. What can you expect if you follow this protocol? Let me give you a realistic timeline, weeks 1 to 2. You're implementing the changes, adjusting medications if needed, starting supplements, beginning pelvic floor exercises. You might not see changes yet, but you're laying the foundation. Weeks 3 to 4. If medication was your primary cause, you should start seeing improvement. Semen volume is starting to increase. Ejaculation is starting to return. Weeks 5 to 8. This is where major improvements happen. Your testosterone is optimizing. Your pelvic floor is getting stronger. Your prostate health is improving. Most men see significant increases in semen volume during this window. Weeks 9 to 12. Full results. The majority of men who are going to recover normal ejaculation will see it happen by this point. Semen volume is back to normal or near normal. Ejaculation feels strong and complete. In the study, 73% of men saw significant improvement or complete resolution by week 12. Another 15% saw partial improvement. Only 12% saw no improvement, and most of those had severe nerve damage. Real patient story. Let me tell you about James. He's 67 years old. For the past year and a half, he'd been experiencing dry ejaculation. He could reach orgasm, but nothing would come out. Maybe a tiny drop. It was frustrating and embarrassing, and it was affecting his confidence and his relationship. When he came to see me, we went through the diagnostic process. He was taking tamsulosin for his prostate. Red flag. We checked his testosterone. It was 312. Low. And when he tried to do a Kegel, he could barely contract his pelvic floor. Multiple issues. So we put him on the full protocol. We switched his tamsulosin to a different medication for his prostate symptoms. We started him on testosterone replacement therapy. He began doing pelvic floor exercises every day, and we added prostate support supplements. At his 4-week check-in, he said he'd had one ejaculation where a small amount of semen came out. Progress. By week 8, he was consistently producing semen with every ejaculation. Not a huge amount, but definitely visible. And by week 12, he told me his ejaculation was back to what he would consider normal. Good volume, strong force, complete satisfaction. He said, "I thought this was just something I'd have to live with. I thought it was permanent, but it wasn't. My body just needed the right support." When to see a doctor. Before I wrap up, let me tell you when you absolutely need to see a doctor rather than trying to fix this on your own. If you have sudden onset dry ejaculation that happens all at once, not gradually, you need evaluation. This could indicate a blockage or acute problem. If you have pain during ejaculation or blood in your urine, you need evaluation immediately. If you have other neurological symptoms like numbness, weakness, or loss of bladder or bowel control, you need urgent evaluation. And if you've tried the protocol I described for 12 weeks and you're seeing no improvement at all, you need a thorough workup by a urologist. There might be a structural issue that requires medical or surgical intervention. For most men, dry ejaculation is fixable, but in some cases, professional evaluation and intervention is necessary. Final thoughts. Look, I know dry ejaculation is an embarrassing topic. Most men don't want to talk about it. They suffer in silence. They assume it's just part of aging and there's nothing they can do. But that's not true. In 73% of cases, dry ejaculation is fixable. You just need to identify the cause and apply the right intervention. Review your medications. Optimize your testosterone. Support your prostate. Strengthen your pelvic floor. Support your nerve health. And give your body 8 to 12 weeks to respond. For most men, that's all it takes to restore normal ejaculation. So here's what I want you to do right now. Go through the diagnostic process I described. Figure out your most likely cause. And start implementing the solutions today. And I want to hear from you. Comment below and tell me, have you experienced dry ejaculation? What do you think is causing it in your case? And are you going to try this protocol? Let me know where you're watching from. If this video helped you, smash that like button. Share it with another man who might be dealing with this, and subscribe to Senior Health Tips for more solutions to problems you thought were unfixable. Your body is more resilient than you think. Let's fix this together. I'll see you in the next video.